A third type of heart disease is congestive heart failure. This is a chronic condition in which the heart doesn't pump blood as well as it should. What happens is that the heart isn't able to pump out as much blood as it receives. You have blood coming into the heart from the vessels that are bringing it back to the right atrium and the left atrium, but it isn't able to pump it through the rest of the chambers of the heart as quickly as it's coming into the heart. And so that leads to a pooling of blood in the veins, the lungs, and the extremities. Signs of congestive heart failure include swelling, also known as edema, and shortness of breath. There are different types of congestive heart failure that come from different causes. Hypertension can cause congestive heart failure. Somebody surviving a heart attack, when it weakens their heart muscle, can develop congestive heart failure. And what this does, it affects the ability of the heart muscle tissue to contract effectively. There's a Khan Academy video in Cocktail Chatter that talks about the different types of congestive heart failure. What congestive heart failure does is it results in an inability for the heart to pump fast enough and can lead to blood pooling in the lungs. Then we have structural defects. There are congenital heart defects. Congenital means that they're present at birth or that you're born with these type of defects. There are acquired structural defects. These structural defects can include heart murmurs, and unfortunately I can't play this link at the bottom for you, but it shows different types of heart murmurs. Heart murmurs are incomplete closures of the different valves in the heart. And some of you may know folks who have heart murmurs, and you may have a heart murmur. There are different types of heart murmurs. A lot of people may have what's called a benign heart murmur. That's perfectly normal. It's not something that needs to be treated. But as they become more serious, what happens is that bacteria can grow on the valves, leading to infection, also known as carditis. If somebody has a severe enough defect in one of these valves, these are the folks that have open heart surgery. Arrhythmias are when the heart is either beating too quickly, too slowly, or irregularly. Different types of arrhythmias include bradycardia, when your heart is beating very slowly, tachycardia, when your heart is beating abnormally fast. Now keep in mind, a person who is in very good physical condition may have a low pulse rate. When I say it's beating abnormally slow or abnormally fast, we're referring to the pulse. A person who is in good physical condition, whose heart muscle is very strong, that heart muscle doesn't need to beat as often in order for blood to get throughout the body. It's very strong. It pumps more blood with each beat because it's a strong muscle. So the pulse rate may be slow. But if somebody has bradycardia and they do not have an extremely strong heart, if they're not physically fit, that would be a condition that needs to be treated. Tachycardia, when the heart beats really fast. Now, sometimes your heart can beat really fast. I gave the example of my blood pressure changing when my videos aren't working out right. My pulse may go up when my videos aren't being made right. However, it's the rate at which it comes back to normal that distinguishes just having anxiety or just not being able to get things done correctly versus having tachycardia. Atrial fibrillation is when the atria, the upper chambers of the heart, spasm instead of beating. Atrial fibrillation is when the upper chambers of the heart spasm instead of beating. It's an irregular type of beat, and it can lead to blood clotting and increasing the risk of stroke if one of those clots travels throughout the bloodstream and cuts off blood flow. Ventricular fibrillation, or VFib, can lead to sudden cardiac death. That's because when you have blood flowing in the lower chambers, when those lower chambers begin to spasm, the blood cannot leave the heart. When you have atrial fibrillation, blood can still leave the heart through the ventricles. But with ventricular fibrillation, that's in all the doctor shows when suddenly they yell, "clear," and they get the paddles and they try to shock the person in order to get their heart to start again. So the VFib, ventricular fibrillation, is an abnormal, deadly heart rhythm. Blood cannot get removed or pumped out of the ventricles, and it pools in the ventricles, and the heart stops. In the video, the gentleman had having a heart attack. It looked like he was recovering, and suddenly he experienced VFib. He went into ventricular fibrillation. They had to use the paddles on him. So the folks in the emergency room setting had to apply paddles to the man's heart. The paddles, or defibrillator, send an electrical current through the heart. The electrical current basically stops the heart so that it can reset to a normal rhythm. What you're kind of having is an electrocardial reboot. The heart is beating to different rhythms throughout the entire heart muscle, and one of the things we said about the heart was that it's an amazing set of tissues that all beat as though they're one tissue, they're one cell. They relax and contract at the same time, and when that rhythm changes, that causes fibrillation. And with ventricular fibrillation, with the inability to move blood out of the heart to the rest of the body, the person can die. You have to reset that pace. And what a defibrillator does is it sends a shock through the heart, resetting the electrical current of the heart so that all the tissues can work together again. So all the cells can contract and relax at the same time. And the last type of disease we're going to talk about in this section is a stroke, also known as cerebrovascular event. Cerebro refers to brain, vascular, blood vessels, cerebrovascular event. A stroke occurs when a part of the brain is deprived of blood flow, leading to damage. There are different types of strokes. On the right, we have what's called an ischemic stroke. An ischemic stroke can be either thrombotic or an embolism. We're just going to differentiate between ischemic and hemorrhagic, and just understand that ischemic means that a clot has traveled to the brain and cut off the ability of blood to flow to a part of the brain. So that clot is stopping blood supply to an area of the brain. The other type of stroke is a hemorrhagic stroke, and this is when a blood vessel ruptures and blood leaks into the surrounding tissues. It's a hemorrhage of blood into brain tissue. There's also something called a transient ischemic attack. It's often a warning sign of a stroke. My neighbor, who's a neurologist, she said that she hates when people call it a mini stroke. It's not a mini stroke. She's a doctor. I'm not. So I'm going with what she says. It's a temporary artery blockage in the brain. With the transient ischemic attack, the symptoms often resolve. Somehow the blood is able to start flowing, but it may be a warning sign of a stroke. After effects of the stroke can be brain damage. And the specific effects depend on what part of the brain was affected, how much of the brain was affected, and how long the brain was affected. Follow-up treatments include physical therapy and measures to prevent recurrence. So this can include behavioral changes, medical or dietary changes. What are some of the symptoms of a stroke? I saw this in an article. It was referenced in a podcast I was listening to, so I wanted to show it to you. They use the acronym FAST: face drooping, arm weakness, speech difficulty, and call 911. FAST. Face, arms, speech, and time. Diagnosis and treatment of cardiovascular disease, there are a lot of different tests that can be done. I'm not asking you to know what all of these tests do. Just know that there are a lot of tests that can be done to assess whether or not somebody's having an anxiety attack or whether or not they're having a heart attack or stroke. The treatments include medication, surgery. There are different types of surgery: coronary artery bypass, angioplasty, and transplants. We'll review each of these briefly, but what you need to know is that time is critical for the treatment of heart attack and strokes. If somebody is experiencing symptoms, don't wait to see a doctor. Medications include what are called the statins, a family of drugs called statins. Some of these are Zocor, Lipitor. Again, you don't need to remember those specific names, but what they do is they decrease the amount of cholesterol that the body's producing. Aspirin inhibits blood clotting. It's a blood thinner. It's kind of controversial right now whether or not folks should be taking aspirin. So I would say that if you know someone who's taking aspirin for treatment of heart disease or because of a stroke, they should definitely talk to their doctor about it. They should follow what their doctor's recommending. And then if the person has high blood pressure or hypertension, definitely treat that. Coronary bypass surgery is when you take a blood vessel from another part of the body and you attach it below the area of damage. In this heart, the dark area represents where blood flow's been cut off. So you take a piece of a blood vessel, you attach it below the damaged area, and you attach it to the aorta, thus bypassing the damage and enabling the blood to flow. Heart transplant is probably one of the most dramatic treatments if a person has severe heart disease, in which they get a new heart. Now, the heart is basically listen to me, just a pump. It's the pump that keeps your body alive. You can have a look at this short video to see how heart transplants are done. I'm not expecting you to do a heart transplant. I just want you to know that it's one of the treatments for severe heart disease. The surgery is referred to as balloon angioplasty. If we look at it one step at a time, you have this balloon catheter that is threaded up through the blood vessels from the femoral artery in the leg, and it goes up into the blocked artery. It flattens the plaque and stretches artery walls. Sometimes these stents have medication in them, sometimes they don't, depending on the person's situation. But what they're doing is flattening the plaque and stretching the artery wall so that the person's blood can flow through the coronary artery. These stents are left in place. What do you do during a heart attack? Symptoms can come and go at first, and you may only have 1 hour to get treatment to avoid permanent damage. Studies suggest that the average delay between the first symptom and calling 911 is almost 2 hours because people are afraid to call an ambulance. They are afraid that something might be wrong. What to do during a heart attack or stroke? Well, for a stroke, a lot of hospitals will provide TPA, the medication the narrator spoke about in the video. This can be used to help to break up the clots that are found in the ischemic stroke as opposed to the hemorrhagic stroke. Remember, there are two different types of stroke. The ischemic one is one that's caused by a clot. One of the effects of TPA may be a hemorrhage because it is thinning the blood. I think that the benefit outweighs the risk. I've never been in the position, but I think if it's a choice between dying and a 6% chance of a hemorrhage, I would probably pick the TPA. Not all hospitals can provide cardiac catheterization. This is the procedure in which angioplasty and stents are put into the heart to open up the blood vessel and flatten the plaque against the artery wall. And not all hospitals have the ability to do that. So you want to look at risk factors for heart disease. I divide them into controllable and uncontrollable risk factors. Uncontrollable, you can't do anything about, so you try to do what you can about controllable risk factors. And they're both listed on this slide. How do you protect yourself from heart disease? I think I was going to put here, pick the right parents, but I guess I didn't. Eat as healthy as you possibly can. Try to manage your cholesterol levels, keeping in mind that cholesterol is only one of the risk factors for heart disease. Blood pressure is another risk factor. Blood pressure can cause that injury to the blood vessel wall that leads to the plaque buildup. Regular activity can help reduce weight. It can help reduce, for some people, cholesterol levels and control blood pressure. Don't smoke. I'm going to be rethinking this in the future. I guess I'm rethinking it right now because I think that the benefits of alcohol are outweighed by the risks. Certainly, if you want to have a glass of wine with dinner, I think that's perfectly fine. I don't think there's any research that says that's not something should be done. But drinking because you think it's going to reduce your risk for heart disease, not so much. If you have diabetes, do the best you can to control your blood sugars. Manage your stress and improve your mental health. Gosh, I'm thinking this might be the hardest one. But you do the best you can. Okay? If you have any questions, please email me. Otherwise, I'll see you in class.